Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest in medical insights. I'm your host, Rhonda Alford, and joining us today is Dr. Sina Pourtaheri, a board-certified orthopedic surgeon at Gulf Coast Orthopedics and Terrebonne General. Welcome to the show, Dr. Pourtaheri.
Thank you, Rhonda, for having me.
Well, I'm so glad you could be here with us today. I know you keep a really busy schedule. Why don't you tell the audience a little bit more about yourself and your role at Terrebonne General?
So I'm Dr. Sina Pourtaheri. I'm one of the spine surgeons at Gulf Coast Orthopedics. I specialize in spinal surgery, and I perform surgeries at Terrebonne General Hospital.
And your specialty is minimally invasive spine surgeries, correct?
Yes.
All right, well, let's talk more about that. What is minimally invasive spine surgery, and how does it differ from traditional surgery?
Yeah, so minimally invasive surgery is the same exact surgery as traditional surgery, except for you're doing it through smaller incisions or access points. So it's the same exact surgeries that we've been doing for decades. However, you're doing it through smaller access points, which equates to quicker recovery and less disability.
And what conditions or diagnoses typically can be treated or require this type of surgery?
So for me, again, I'm a very conservative spine surgeon, so majority of the cases I treat non-operatively. The only cases that I think non-operative care is not the best of scenarios is when you have spinal cord compression with actual fluid in the spinal cord. But most of the cases you treat non-operatively. But in terms of patients that fail conservative treatment and require surgery, minimally invasive surgery can be used for the majority of cases, except for certain cases where you have large scoliosis that's very stiff. But the majority of cases have been moving in most spinal surgeons' hands to minimally invasive, and that's my preference for the majority of cases that require surgical intervention.
Okay, and what kind of patients qualify or are a candidate for this type of minimally invasive surgery?
So the minimally invasive surgery is the same as traditional. So it's the same problems that you'll be treating surgically with traditional, but with minimally invasive techniques. So the majority of spinal conditions that require surgery, minimally invasive surgery can be used. Only times where it doesn't work as great is when you have patients with very large scoliosis that's very stiff. And so larger, more traditional cases are able to kind of realign the spine a little bit better and loosen up the spine better in those cases. But the majority of spinal conditions that require surgery, minimally invasive surgery is a great option.
Okay, and there are many benefits. What are the main benefits of having a minimally invasive surgery?
So the minimally invasive surgery is basically the same surgery, but you're doing through small incisions. So what does that equate to? So you'll have less disruption of tissue, which means easier recovery. So less disruption of the muscles, and so patients are less sore, and they can return to work quicker than traditional surgeries, and that's been published pretty readily in the literature, showing that patients will have an earlier return to work with minimally invasive surgery, but they're getting the same outcome, meaning they're getting the same amount of long-term relief. Mm-hmm. However, they can return to work quicker. So you're obtaining the same goals of the surgery in terms of long-term benefit to the patient. However, patients are recovering quicker, and also they have less complication rates with minimally invasive surgery. So majority of cases, almost all cases that require spinal surgery, I always look towards minimally invasive, as it clearly is the wave of the future in spinal care.
What happens during a minimally invasive procedure? Can you give us a little bit more detail?
That's a great question. So in terms of safely doing minimally invasive spine surgery, there's three things that are required to it. You have to be able to see as well or better than traditional surgery. You have to be able to locate radiographically that you're in the right location, so knowing you're in the right spot. And number three, you have to know that that the neural elements are safe and protected during the surgery. So in terms of minimally invasive surgery, you have to be able to see. So a lot of the surgeries will do dilation techniques. So make a small incision and then use dilators to expand the tissue to get you the access to the area. And then you'll put a tube or some kind of retractor system, which you're looking through a microscope, which illuminates, which allows you to see where you're going to be placing your tools in terms of the surgery. And so then you get that visualization. Then radiographically, through fluoroscopy or other image-guided techniques, you make sure that you're at the right spot, that you're going to exactly where you want to do the surgery at and where you want to decompress the nerve. And then you use neuromonitoring to make sure that the nerve is happy and that you're in a safe location in terms of the neural elements. So there's three components. So you're basically having the same visualization, things of traditional surgery. However, you're doing it through smaller incisions, and you're attaining that with these different technologies. So you can be able to have the same access, but through smaller incisions.
What's a minimally invasive procedure recovery time as compared to a regular procedure?
In terms of the surgeries, in spinal surgery, we kind of break it up into surgeries that where you're just decompressing a nerve, which requires no implants, versus implant-based surgeries like fusions or disc replacements. In terms of decompression surgeries, if you do a minimally invasive, patients can return to work pretty quickly. A desk job, probably 5 to 10 days. But with fusions, we've also have shown that patients can return to work quicker than traditional fusions and return to work. And you can actually shave in a fusion-based surgery a lot of times 4 weeks, 6 weeks. So you can shave a month or so off in terms of return to work with minimally invasive versus traditional. And that's been reported in the literature pretty readily. And I see that in my patients as well. So again, I always think about minimally invasive spine surgery when somebody does require surgery, as it provides a better result and more predictable result, in my opinion.
Right. And you also said there are less complications, correct?
Yes. So the studies have shown infection rate is less. So again, you're doing the same surgery. So there's big incisions and small incisions the size of Band-Aids. And so if you have a big incision, you're disrupting more tissue. You're more exposed to elements of the air, which can increase their chance of infection. And then also you're doing more disruption to tissues, which shows that the muscles are more disrupted. There's laboratory values that show that their myoglobin levels are getting elevated. And so they're getting more of an inflammatory response because there's more disruption. More disruption, more soreness, more inflammation. Less disruption, quicker recovery, less inflammation, less soreness. So minimally invasive surgery has shown to have a lower complication rate, and infections, one of the most cited ones in terms of complication rate, less infection rate with minimally invasive.
How long does a minimally invasive surgery take?
Yeah, so we kind of went over the two categories of surgeries. There's the ones where you're just decompressing and placing no implants, and then there's the ones where you're placing implants like fusions and disc replacement. If you're just decompressing a nerve in the lumbar spine, for instance, and just it's at one level, the surgery is very quick on the surgeon side, probably under 30 minutes for one level disease in terms of decompressing nerve. Again, the patients have to go under anesthesia, be positioned. Those add to the time. But in terms of the part where from the time from incision to closure, generally one level decompression surgery is under 30 minutes. Fusions take longer, but again, studies have shown that you have quicker times, meaning surgical times are shorter, both with the decompression surgery, but also with the fusion surgery. So you can obtain the same goals with less operative time, and less operative time clearly has shown that you have less complication rate. More the patient is in the operating room, exposed to elements of the air, more chances of complications. So length of surgery does relate to complication rate. So again,
So let's minimize those.
Let's minimize those. So in medicine, everything's moving more towards precision and predictability, and patients are demanding it, and that's where the trend is going. And all this stuff gets analyzed. Particularly, we'll see that with AI and big data, that we'll be able to learn more and more. And also at Gulf Coast, we're also doing a lot of that analysis in terms of determining best outcomes and practice measures.
Okay. And are these types of surgeries performed on an outpatient basis, or is it an inpatient surgery?
So the majority of the cases are being done as an outpatient. So either the patient's going home same day from the time of surgery or being discharged within 24 hours of surgery. Decompression surgeries, all the patients are going home same day unless they have extensive medical history where the anesthesiologist wants to monitor them in terms of their cardiac function and things like that. But again, in terms of decompression surgery, where you're placing no implants and just decompressing a nerve, pretty much everybody goes home same day.
And what's the recovery process like?
The recovery process, again, is shorter. So in terms of traditional surgery, the fusions, you're shaving about 4 weeks to 6 weeks. So you're shaving almost a month off in terms of return to work. And if you do a decompression surgery, a lot of times where patients can return to a desk job probably 5 to 7 days after surgery. Fusions will be a little bit longer in terms of return to work. And it depends if they're returning full duty versus just kind of returning to more of a desk job or sedentary position. But again, the overall trend in terms of minimally invasive versus traditional recovery is faster and less intense.
What is the main takeaway you want our audience to know about minimally invasive spine surgery?
So when surgery is required, minimally invasive surgery provides a better recovery and a predictable recovery, and you're obtaining the same goals as you were with a traditional surgery. So in terms of minimally invasive surgery, it's here to stay, and those technologies are going to continue to improve, providing even more precision and more predictability and even faster recovery. So minimally invasive surgery, I would say, is here to stay, would be the main take-home message.
And that's what people want, is faster, quicker, better.
Yes.
Well, thank you so much for joining us today and sharing this helpful information.
Thank you for having me.
For more information about minimally invasive spine surgery and Dr. Sina Pourtaheri, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcast. Thanks for joining us.